Thank you so much, Vicki, for your kind introduction. I very, very much appreciate that. Want to make sure that I'm heard well. So if you can't hear me, or I should say, if you can hear me, go ahead and click the little hand button on your display screen. Okay. Good. Okay. Excellent. So as Vicki mentioned, my background is up on display right now. Just to highlight a couple of things about my experience and background, I'm a mental health practitioner. I've had a private practice in mental health now for just about 20 years. I've been in the field much longer than that. Through my experience as a mental health counselor over the years, I've learned quite a bit, both from my patients that I treat, as well as in my own personal life, about burnout and compassion fatigue and the toll that it takes on people who are in a profession that is highly service-oriented. And then I learned over time, when I went out and started to go to organizations and companies about 10 years ago, I started that process. And what happened was I realized that it's not just in the healthcare industry. I spoke to folks in the telecommunications industry and in the pharmaceutical industry and the retail and hotel and restaurant industry. And lo and behold, many of these folks were burned out, suffering from fatigue and having a great deal of difficulty. And so I developed this program and have been spending quite a bit of time, not just in my own clinical practice, but out in the community working with agencies and private business in helping others to manage, to first identify burnout and then to have strategies and skills for managing it. So, in the meantime, I'd like to share a personal story with you, and this personal story really starts back to when I was very, very young. My grandfather, on my dad's side, who was a huge influence and had a major impact on me and my life, was a very hard worker, and he owned and operated restaurants in the Chicago, Illinois area. Worked his tail off for many, many, many years, and if anybody experienced burnout, it certainly had to be him. My grandfather was a very hardworking, compassionate, and loving human being, and he was always supportive of my career choice to be in the mental health profession. Well, I take you back to 1998, really about 20 years ago, when my grandfather was in his last remaining year of his life, and he was stricken with Alzheimer's. And if any of you know that Alzheimer's takes a toll really on the caregivers a great deal, I had been doing a lot of direct care with him and visiting him and spending time with him, while at the same time having just recently graduated from my master's program in counseling and obtained my first job out of graduate school. Now, this job was in an agency with kids and adolescents, and I was getting ready to do my very, very first clinical presentation in front of a large team of people that included state social workers, probation officers, because we worked with kids that were adjudicated as well, and psychiatrists, other mental health providers, family members, and of course the patient itself. So there were probably about 18 to 20 people in the case presentation for my first ever case presentation, which was on a Friday. And that Friday morning, prior to the case presentation, I got a phone call at 4:30 in the morning from my father, who had said that my grandfather had taken his last breath. And I had a tough decision to make, because while I wasn't directly involved in making funeral arrangements, and the funeral would not have then been that day, I needed to figure out whether I should go to work or not, or go to my family. And I decided that I wanted to honor my grandfather's life by going to work. And I could not have been more wrong. I was tired. I was exhausted from caring for my grandfather. I needed to be with my family, but I had this feeling that I must go on and I must do something to honor him. And the reason that this was not right for me to do is because I got just about every piece of clinical information wrong, including the patient's date of birth and how what the clinical presentation was. I really, really bombed. Like if I were a stand-up comedian doing my first stand-up, I would have been booed off the stage. It was so bad. And so I was immediately called into the office by the clinical director, who said, "How do you think you did?" And in a very stern tone of voice. And of course, I said, "I think I did terrible. My grandfather just died and I'm really not focused." And he said, "And I wanted to show up to honor my grandfather and be, show up to work to honor his memory." And he said, "Well, you should have stayed home and been with your family. I'm compassionate about the fact that you lost your grandfather, but you can't bring this kind of stuff into work and make mistakes like this. You should have gone home." At the time, I was extremely upset by his response, but I think he really did a big favor for me. He woke me up to the idea and the notion that I have to have limits, be able to set boundaries, even when I feel like I can't go on. Now, I want you to take a moment and think a little bit about your life and your experience and how you get sidetracked and what happens when your candle doesn't look like this, or looks like this, I should say. So my candle had burned out, and it didn't feel very good, obviously, and I was really trying to please too many people, which is a common symptom of compassion fatigue and burnout, is when you are trying to, when one is trying to please too many people, is one of the pertinent symptoms. So I'm sure that you have many examples, and this is but one experience and one example that I can share with you. There are so many things in our day-to-day lives, and we're going to talk a little bit about that today. I'm going to cover that today from some different examples that I will share with you. In addition, one of the things that I want to be able to do is I want to be able to sort of use this time together as not an opportunity to just talk about how our candle is extinguished, but I want to talk about how our candle can remain on all the time as much as possible. If we were sitting together in a room, I would pull out a candle and I would ceremoniously light that candle and keep that candle burning throughout our discussion today. And so if you have a candle in your office or at your home where you're listening, take it out, get a match, and let's light it together, and I'll light a virtual candle with you, and we will keep this candle burning throughout the time that we have together today in honor of this idea of burning up, even when we're feeling like we might be burning out. And this candle is symbolically also burning so that you can remember to be constantly aware of the signs and symptoms of burnout and compassion fatigue that I'm about to go over with you today. Because one of the big pieces of philosophy that I've used in my personal life, that I've treated my clients with, that I've talked with other organizations and companies with, is the idea that we must be very, very aware of our burnout and compassion fatigue symptoms and signs. The more cognizant that we're aware of these, the more we bring ourselves toward that awareness, the higher likelihood we're going to manage it more effectively. A 2017 study in the UK showed that surveyed several psychologists in the UK, and it found that over 65% of these psychologists had experienced burnout at some point in their career. So not only psychologists, but other professions have higher and higher burnout rates. And so we must study this and understand how we can better prevent burnout and understand compassion fatigue, and we're going to do that today a little bit. So our objectives are to understand burnout, its causes, and its warning signs. That's the first thing we're going to cover. I wanted to spend some time distinguishing between burnout and compassion fatigue and what the difference is. So we're going to talk about this particular type of burnout called compassion fatigue and where it shows up most, which happens to be in the healthcare industry, but it can happen in just about any industry in which we are servicing other people or working with people. And then we're going to really spend some time on identifying some tools and strategies for managing and preventing burnout. And throughout this process, what I want to do is help you reignite meaning, passion, and importance through your own individual burnout prevention and what I call burn-up invention plans. And this is an idea that I came up with many, many years ago that really involves finding ways that are positive, that are strength-based, and that we can work together and individually on in order to really burn up rather than burn out. So let's talk a little bit about burnout. Really, what is it? What is it? How is it defined? And its basic definition is an experience of exhaustion of physical or emotional strength or motivation, and it's usually as a result of extended and prolonged stress or frustration. Now, it's a term that gained a lot of popularity in books in the 1940s, and it peaked around the mid-80s. And while it's dipped in its use since the mid-1980s, the term is still very widely used to communicate a specific type of psychological distress in the way that I just explained. And so it's really a state, if you will, and obviously you're going to hear me use the term stress quite a bit. So I want to focus on the fact that this can be a very physical experience, and we're going to talk about physiology in just a few minutes. A lot of times when we're working and we're working hard, we don't pay attention to what's happening internally in our physical bodies. And we're going to learn to hone in on our physical bodies as we start to think a little bit about burnout. It also, excuse me, takes a toll on our emotions. And we're going to spend some time today looking at the emotional symptoms that we experience and then ways that we can combat the symptoms that we experience emotionally. Now, it's interesting to me that burnout, the definition that you see in front of you does not talk about behavior. And I'm going to talk a little bit about behavior because behavior is the way in which we measure our emotions, our feelings. It's a measurement tool and can serve as a gauge for understanding just how burned out you might feel or be in your certain situation. So I want you to pay attention. We're going to be paying attention here in the early part of our training on the emotional, the physical, and the behavioral side of things. And alongside the emotional, because our thoughts have a lot to do with emotions, we're going to also focus on some of the mental traps that we get in when we're experiencing burnout. Okay, so one of the biggest causes of burnout is this word stress, this experience of stress. Now, of course, some stress is good, but obviously, as we all know, prolonged stress can lead to burnout. You'll have to forgive me, I'm just getting over a cold, and so there's a little bit of cough left in me, so I'll try to speak as clearly as possible. So prolonged stress can bring us toward burnout, and stress is something that is extremely important to focus on when it comes to burnout. Stress in America is actually lower based on research in recent history. According to the American Psychological Association, they did a study in 2015. Now, I know it's 3 years old. That being said, that study seemed to suggest it's lower. However, even though it peaked in 2010, has been declining a little bit, mean stress levels were still much, much higher than what is deemed a healthy stress level. Healthy stress levels are supposed to be approximately a 3.7 on a scale of 1 to 10. And in 2014, they were measured at 4.9. Now, I have been unable to locate more recent studies, but I can certainly tell you that from the experience that I've been having in my clinical practice with the patients that I see, there are, that I think that stress is on the rise even more now, and that it's kind of moving back up into the higher numbers. What are some of the reasons? Well, people are overscheduled, they're busy, emotions are on the edge, there are less resources and more demands happening. People therefore feel under the gun. People are experiencing a lot of fatigue and loss of energy, and this is leading to people coming into therapy offices with less energy, lots of anxiety issues, even some depression issues, and it's also taking a physical toll on folks. So stress is a huge impact on burnout. Hans Selye first coined the term stress in 1936, and he had famously said that it's not stress that kills us, it's actually our reaction to it. Now, my colleague and mentor, Dr. Robert Sapolsky, who is a neurobiologist and primate researcher from Stanford University, sort of resurrected the stress research by spending a lot of time in Africa working with baboons in Africa, and he found that when the primate population is done gathering their food, they spend hours and hours and hours sort of pushing each other's buttons and keeping the lower ones down and dominating from the ones who were bigger, larger, and had more seniority among the group. Now, if that doesn't sound like human beings, I don't know what does. He extrapolated his research into human beings, noting that regular workers who were under managers tended to be the most stressed, and managers who had to manage those workers and then also were managed themselves had even higher amounts of stress because of the duality of their role. And so basically human beings don't have to really work hard to find food anymore, and so we spend a lot of time creating stress that isn't necessary. And so this really goes back to what Hans Selye said about that stress does not kill us, it's our reaction to it. I do a lot of work with my patients, teaching them how not to fall into that reactive primordial part of their brain in the amygdala, the old brain, where we tend to be reactive and make up things about stress that maybe just aren't really true. So we want to pay attention to our stressors, and we're going to look at those areas, several areas in stress. When we look at signs and symptoms, we're going to try to understand our stress based on our signs and symptoms. But first, I want you to start your burn-up invention plan by identifying some of the current stressors that you're experiencing in your life. So we're going to do a series of exercises, and the first is on stress. And what I'd like you to do is, hopefully you have something to write with or type into your computer, but you're going to walk away today with a burn-up invention plan. And this first exercise is a stress situation exercise. And what I'd like for you to do is take a little bit of time and write down a situation or situations at work or in your personal life that might be causing problems at work that are causing you more stress than you'd like. Right now, you don't have to write down the feelings associated with it. You don't have to write down the signs or symptoms, just the situation. What are the stressful situations? Did you know, by the way, that of all general situations, work is second only to money as the issue causing the greatest amount of stress for most Americans? Money, for example, could be one of the recent conflicts that's bugging you, or the amount of work that you have to get done by a certain deadline, or a particular relationship at work. These are some of the situations that previous participants have shared in their stressful situation exercise. Now, next, what I'd like you to do is rank the stressor on a Likert scale from 1 to 10 so that you have an idea of what's most stressful. So if you have 2 or 3 situations that you've written down, maybe one of them is a 9, one of them is a 6, one of them is a 7. Go ahead and rank those, okay? And the purpose of this is to create a greater amount of awareness through this exercise so that when talking about your stress with a friend or a colleague or even internally thinking about it, you have a gauge that you can look at, and you can begin to think about how we can measure outcomes of stress when we're working on reducing stressors, as this process shows both ownership and awareness for your stress. Now I'm going to bring in another expert, also a Stanford expert by the name of Dr. Kelly McGonigal. And Dr. McGonigal, oh, I'm getting some interference from somebody. Hello? Okay.
Hello?
Yeah, I'm getting a little bit of interference. I can hear Vicki. I think you're...
Yeah, I'm really sorry. I'm going back on mute.
Okay, thank you. Back to Dr. McGonigal. So Dr. Kelly McGonigal, and Dr. McGonigal has a few TED Talks. Recently researched one of her books, read one of her books about willpower. And what's very interesting is her recommendation revolving around stress and stressful situations. She talks a lot about the science of stress and stress on the brain, is that we want to look at this Likert scale idea as a way of we can't get rid of this stressor, but what we can do is we can respond with a reduction in behavioral variability when it comes to symptoms that present. And we're going to talk about those symptoms here in just a brief moment. So let's think about not extinguishing and getting it down to a 0, but let's try to think about managing how to move it down the scale so that the stressor becomes less significant in our lives. So trying to kind of ease you into the sort of the theoretical model of working with stress revolving around burnout. We're not trying to go from an 8 down to a 2 or a 1 or a 0. I often, in my treatment plans with my patients, when they put an 8, I ask them, where would you like to be? And 9 times out of 10, they say, I'd like to be at a 0 or a 1. And I say, well, imagine what it's like, what it would look like if you got to a 5 or a 4, and you really got it to a point where it was more manageable. What would that look like? So the idea is that you're looking at these situations you've just written down, and what we're doing is we're Likert scaling it at the beginning or where it is right now, and we want to move it down over time as we build these strategies that we can work on over time. Okay, so hopefully you've had ample time to write down a few stressful situations going on in your life. And now we're going to talk a little bit about some causes of burnout. One of the biggest causes of burnout is frustration or anger. It's one of the most common causes. According to an APA study, American Psychological Association, once again, studied symptoms and causes of burnout. Irritability and anger was the highest among all symptoms in this particular study. So I think it's really important that we have a brief discussion about how people typically will deal with anger. And then this is going to come up again momentarily in the signs and symptoms, especially when we talk about behavioral symptoms. So think about what you do when you become angry. And if we were live, I would get some feedback and listen and hear from people about what happens when they're experiencing anger. Most people will have their stress response activated. Okay, and so we all know that what happens in our primordial stress response is one of 3 things. We either fight, we flee, or we freeze. Okay, I'm sure you may have heard that before. Fight, flee, or freeze. Or yeah. So those are the 3 Fs, and or any combination of that. Some people do 2 of those 3 things, and some people tend to do all 3 within a stressful period. As much as that sounds odd, you can actually do all 3 when you're stressed. So one of the observations that I've made over the years in my clinical practice is that people will often report in session that they experience this notion of the further away from my anger, no matter how far away I can get, the better. Now, one thinks that that's a flea, but oftentimes people fight their anger in order to get away from their anger. In other words, they put up barriers, they fight with it, rather than learn to move gently and appropriately through it. So the first thing that becomes really important as a cause is our awareness of our own anger. So we want to become accountable for that anger, and in work-related relationships, in personal relationships, family relationships, what we want to do is we want to own it. So the moment that you feel that anger, it becomes paramount that you move as quickly as you possibly can into awareness so that you then can move into what Terrence Real, famous couples therapist, says, secondary consciousness. Secondary consciousness is a place where one takes accountability for their own experience of their anger, no matter how it came out. Hey, I'm really sorry that about my approach and the way I said what I said. Could we try to work through this? Now, you might be right about the thing that you're angry about, but when you come across as being angry, it adds more to the stress and therefore leaves it open for leading to burnout much more quickly. And this is where productivity in the workplace really suffers. A lot of employees will stand by what they believe is right and not pay attention to their nonverbal behavior in their anger, their verbal behavior in their anger, and will defend their position at all costs. So my recommendation is do anything you can in the moment, and you'll see we're going to go over some different strategies that will help you move out of first-level reaction, as Terrence Real calls it, and into second-level anger. Into second-level consciousness to be able to work on your anger. By the way, I should pause and let you know that if questions are coming up about any of these concepts that I'm introducing, write them down and we can cover them at the end during the Q&A part of the discussion. So, some people move away from anger. Some people do internalize it and push it down and become depressed. And so I call that acting in. So when people move away, they often will act out, and we'll talk about what ways people act out. People will also internalize and move in, sometimes isolate. I get a lot of clients that come in and they're depressed. And so really, as I mentioned just a moment ago, the real solution is to move toward a pathway toward presence and awareness and accountability. Okay, you'll hear me say that many, many times. All right, so let's move into the second exercise, which is important here. We're going to move into frustration situation. So before we talked just a little bit about stress and what's stressing you, and now you're going to look at the second exercise from the lens of what makes me feel frustrated. Now, you might put what you already have on your stressful situation on there. What I also want you to do is to write down certain things that routinely come up for you that create frustrations for you. So it could be parenting one of your kids. It could be experiencing a type of conflict with a certain employee or a supervisor or a supervisee. But the idea would be to really sort of think about what sort of situations consistently come up in my life that make me feel stuck, that make me feel frustrated or angry. So some of the previous participants said things like traffic, a difficult employee, people not showing up to work on time, work being done inefficiently. These are some examples of what has shown up on prior participants' list. Next, I also want you to, on a Likert scale, rank the severity, 10 being the most severe, 1 being the least severe, of how frustrating these situations are for you. So you have your list, you want to, are they a 6, are they a 9, what are they, and then we want to try to move them down the scale and manage them more effectively. job. You're doing a fabulous job getting your burn-up invention plan working here. Now, we're going to move into part 2 of our talk, which we're going to dive into the signs and symptoms, as I promised that we would, really more to gain a greater awareness. Some of what I'm about to talk about is going to be very obvious and certainly review, but the purpose of talking about this is to really get you to dial into how these particular symptoms might manifest in your life. And if you're going to redo this training on some level, you can use these slides and these exercises as a way of helping some of your employees or others that you work with dial into their signs and symptoms, because I think this is really important to cover. So let's talk first about the physical signs of stress and burnout. So we talked about some of the causes of burnout, defined burnout, and now we want to get really specific with the physical signs. These are not by all means exhaustive of a list. There are many other physical signs, but these are some of the most highly common signs that show up as far as physical signs. So one of the prominent signs of stress as it relates to physiology would be sleep issues. And what I mean by sleep issues, because you're going to see this come up in the behavioral category as well. But what I mean is people who are having problems sleeping due to medical issues or stress or other problems. It's just sort of the general idea that sleep really impacts our physiology, and the better sleep we can get, the less likely we are to have more physical signs. And I think it's important to remember that not only do each of these 3 general categories, the physical, the mental and emotional, and the behavioral, feed off of each other negatively, but each one of these categories can affect the others. So when we're having problems sleeping, we might have problems in all of these other areas I'm about to talk about. And so you can see how this negative cycle can really exacerbate one's life and lead to burnout. Another common physical sign would be appetite or stomach issues. I get a lot of complaints from clients who are experiencing physical symptoms of stress and burnout and even depression, that they've lost their appetite. They don't feel so good. They don't feel like eating, or some go right to food as an answer to their stress. So we have 2 things happening. One, we have someone who goes toward the food, and that would be an acting out behavior. And 2, people who go inward, maybe don't have an appetite and act in by not eating. And that could also be seen as acting out too, by not eating, but most people see that as going inward and somewhat of a non-caring behavior. So stomach issues are a part of that for many people. That can also lead to gastrointestinal issues. I have a lot of clients that are suffer from anxiety and stress. They're burned out and they experience a great deal of GI problems. IBS, irritable bowel syndrome is one. Many people who are suffering from stress experience terrible headaches, including migraines. And the higher the stress, the more apt or prone their migraines can come in to play. So we look at things like, when I'm assessing things, how bad is the stress or burnout, I always assess, how often are you getting the headaches? How long are they lasting? On a scale of 1 to 10, how severe are they? When do they abate? And how do they usually abate? I'm interested in all of those questions, not just as it relates to headaches, but anything on this list or otherwise. Some people experience chronic fatigue in their body. They ache, they have pain, they have chronic pain or muscle tension. All of these categories often get treated with opiates and other types of heavy medication. And in my experience, that's only added a much bigger problem. It typically exacerbates the problem, as it might give temporary relief, but often what happens with patients is they become dependent upon these medications, cannot get off of them, and for even some, they become addicted and they begin to abuse these medications. So I work very closely with doctors revolving around when it's appropriate to, psychologically appropriate for the patient to have these medications. And I'm very, very conservative in my views about that and try to move people toward a more holistic view of addressing pain and pain management. Yet at the same time, I have a tremendous amount of empathy for people who experience chronic pain, that these people are very stressed and extremely burned out, and it's a delicate balance, and it takes a lot of convincing to try to get them to move away from a program of psychopharmacology, or I'm sorry, not psychopharmacology, of pharmaceutical treatment versus combinations of therapy and exercise and other types of support. And then finally, high blood pressure is another huge physical sign of stress and burnout. And again, these are all signs that can feed off of each other and worsen when stressors come into play. So it's your turn to take a moment and think about your physical signs in this third exercise. And any of these on the list or others that weren't mentioned, what I want you to do is take a moment and write down the physical signs that occur for you that might lead to burnout, that certainly create stress. Now, you might not be burned out from them right now, but what are your risk factor signs? Like, I know for me, I've had high blood pressure in the past, and I have to constantly remind myself that my blood pressure can be affected by stress. So what is yours? What are your physical signs? Go ahead and scale them as well. Are they an 8? Are they a 10? Are they a 7 when they come on? And think about the higher you're going to put a higher number for things that have an increased frequency, duration, and intensity. The higher the frequency, the higher the duration, and the higher the intensity, the higher the number you're going to put on these physical signs. Okay. Give you another 10, 15 seconds, 30 seconds. The next grouping of signs that we're going to cover are the mental and emotional signs. Now, this, of course, is where, while I treat patients in all these areas, this is where one of the fundamental areas that we look at as mental health practitioners in terms of symptomatology and trying to understand. This is where we do a lot of assessment. We certainly assess the physical and the behavioral, but there's a lot that can be taught, that can be told through the narrative of people as it relates to mental and emotional signs. So again, not an exhaustive list, but certainly these 7 are some of the highest symptoms that we see in stress leading to burnout. So irritability is very, very common. Frustration and anger, as I mentioned earlier, one of the most common as a cause and a sign and symptom. Many people experience problems with concentration. They come in and they present and say, you know, I can't focus on my work. I'm too distracted. And some of those distractions lead to behavioral problems and behavioral signs. We'll talk about that in just a little bit, and can exacerbate the concentration issue. Many people come in and they talk about having less energy and feeling a sense of fatigue. Some come and say, I can't stop the thoughts from racing in my head, especially before I go to bed at night, or I wake up in the morning and my thoughts are just going, and I keep waking up early and I can't stop my thoughts from moving. I feel overwhelmed or anxious in addition to irritability, or even without the irritability. And I've had numerous people who experience a high degree of stress tell me that they've experienced what we in our industry consider panic attacks. And panic attacks are situational anxiety attacks that are so profound that it feels like you're having a heart attack, and they're very short in duration, but they feel like they last for a very long time. And they are so debilitating that when they happen, people can't carry out any sort of function, especially if they're driving or operating machinery. So we want to look out for things like panic attacks in the form of overwhelm and anxiety. And finally, irrational negative thoughts. This is a very common mental sign where people will experience lots of negative thinking that are in the form of all or nothing thinking or awfulizing. If you want a really good resource, there's a psychiatrist who wrote a book in the 1980s, and the book's been revised many times. He talks all about irrational negative thoughts as it relates to depression and anxiety, and his name is Dr. David Burns. He's an MD psychiatrist, a super warm guy. I've been to his trainings and met him personally and read, read this book several times. It's a fabulous book for combating irrational negative thinking. The other person that I really respect and value in this field revolving around how we make up narratives that may not be true is Dr. Brené Brown, and she's a contemporary social work researcher out of the University of Houston who has written many best-selling books, including Rising Strong, Daring Greatly, and I believe she has a new one out called Braving the Wilderness. But these are really, really excellent materials that you can get your hands on to help you learn more about burnout and stress from a different type of perspective and deal with some of these symptoms that we're covering today. Okay, your turn. What I'd like for you to do now is this fourth exercise, which is to focus on your mental or emotional signs. What are the signs in this category that might lead to burnout for you when you're under stress? Go ahead and write those down. And then score them on, rank them on each of them on that Likert scale so that we can get a general idea of what the severity of each mental and emotional sign is that you personally experience. And again, this could be work-related, personal-related. Either way, it doesn't matter. Try to get as specific as you can. So sometimes it's hard to write down these symptoms because it's difficult to put your finger on what you're really sort of emotively feeling. So, be as specific as possible. Okay, the third area that we're going to cover as far as symptoms and signs that can lead to burnout is the behavioral area. Now, we go back to the stress concept and we talk about how human beings deal with stress. Let's bring that back into this slide here and remember that we all human beings have this primordial stress response, this reactive part of who we are that makes us fight, flight, or flee. Well, one of the ways that we fight, flight, or flee, mostly fight or flee, or freeze, is we experience these behavioral signs. So we might decide to create relational conflict in the form of arguing a point. Sometimes relational conflict is very nonverbal. Studies seem to suggest that nonverbal behavior is 65% of communication. And so conflict sometimes arises by assumed gestures and postures and tones of voices and things like that. And so we fight sometimes by putting up walls. We create conflict by doing that. So there's many, many different ways. In fact, I've done trainings just specifically on communication and relational conflict. So we also see an increase and rise in substance use and even substance dependency and substance abuse. And when we look at substances and substance abuse, we're not just talking about drugs and alcohol. That's the most common substance that we think of. But if we think a little bit about abusing substances, there are many things that we can abuse. I have patients come in, they have gambling issues, they have issues with internet pornography. They have issues with just surfing the internet and using the internet too much and being on Facebook at all hours of the night. They have issues with sort of being workaholics and just abusing their bodies by constantly working and not stopping. So to me, this term substance abuse is much more broad-based than it ever has been. And so we want to begin to look at these kinds of quote-unquote acting out behaviors that we do in relation to using substances. And, you know, there are so many things that we can get high on, so to speak. Anything that sort of gives us that promise of high reward, that type of behavior that basically creates that endorphin rush is, in my opinion, an increase in substance abuse. And the Kelly McGonigal book really talks a lot about that, the Willpower book that she wrote. So we see a lot of this in behavioral signs and in ways that we become reactive. Communication problems, which go along with relational conflict. We see impulsivity, which can be also a part of substance use and abuse. People become very impulsive in their behaviors. We have this acting in experience of distancing, isolation, and withdrawal. We also have this issue of eating, and not just talking about a full-fledged eating disorder, but a lot of people have what I call disordered eating, meaning that they don't eat throughout the day because they kind of forget, they're so stressed, or they eat too much because they're stressed. These are ways that we sort of disorderly eat. We need to work toward having more balance in our way that we approach food and mindfulness. And one of my dear friends and colleagues, he's not a doctor, but he's a master's level LPC. His name is Donald Altman, and he's from Portland, Oregon, and he has a wonderful book about mindful eating that is amazing when it comes to combating eating issues. Of course, sleep problems, I said it would come up again in this particular category, people not going to sleep at the right time. And we're going to talk about a resolution to sleep here, just this third part that we're about to come up to. And then, of course, a lack of exercise is a very, very high behavioral stress and burnout. And in some people, in rare cases, I've seen people who over-exercise and beat up their bodies, and that can lead to stress and burnout. Okay, well, I know you might not be a coffee addict or a smoking addict. Any of these behavioral signs that I mentioned, or ones that you didn't think that I didn't mention, go ahead and write them down in this fifth exercise as your behavioral signs, and then rank order them. And then we'll go ahead and move on and talk a little bit about compassion fatigue. So before we move into compassion fatigue, I just want to kind of close out this sort of general burnout signs and symptoms category, if you will, by giving you some other general thoughts on burnout signs. If you experience low motivation, or you're struggling with productivity at work, having distractions from staying on task, as I mentioned earlier, some general exhaustion or fatigue, another sign might be missing too much work. And this is a big one, feelings of resentment are building. These are signs that you might be on the road to burnout or burned out. So it's important to pay attention to the macro of all of this as well, not just the specifics of what I mentioned earlier, but to recognize that these are some common experiences that people who are experiencing burnout have. Remember that awareness of these signs and symptoms we've just covered is the first step and is absolutely key. Well, there's a particular type of burnout in the healthcare profession, and I believe that it extends to any type of work that we do as it relates to human beings or other people. We have a place in our heart that is extremely compassionate and caring. We feel a sense of empathy and sympathy for other people, and often, especially as a healthcare worker or an attorney or anybody that directly works with people, we want to take away their pain. I've seen hotel and restaurant people who say, hey, I want to make this a pleasurable experience for you and not a painful one. When you talk to customer service representatives over the telephone, they hopefully want to make an experience non-painful, and you want it to be a non-painful and a pleasurable experience. So we're looking for compassion in others, and that compassion that we see in others, we have to model for ourselves in everything we do. Now, compassion fatigue is classically defined as a secondary trauma to a helping professional who experiences emotional, mental, or physical exhaustion, i.e. the signs and symptoms we talked about just a moment ago, while helping another person. So you can see that this is the case with just about anybody that talks to other people or interacts with other people in the workplace, even at home, within our own families and our friends' circles as well. Now, compassion fatigue differs from burnout in that it is under the umbrella of burnout. It is a specific type of burnout. And one of the things that's paramount in compassion fatigue, and if we go back to my story with my grandfather in my very first placement in my employment, the professional feels as though he or she must keep going on. So that is a paramount tenet that defines compassion fatigue. Some of the causes include increases in work demands, less resources, an inherent desire for caring in the human being. Perhaps the environment that you're working in has unclear empathy boundaries, and simply having poor self-care, not taking care of yourself. I think that in my situation that I explained at the beginning of our talk today, there were definitely unclear empathy boundaries. There were definitely some experiences of poor self-care. I was not caring for myself and thinking about what would be best for me. I was instead thinking about what would be best for my grandfather, how to honor him, and how to make sure I came through, and that I was the only one who could do this case presentation, and very, of course, any other covering clinician could have done that, or we could have rescheduled it. So these are some of the common causes of compassion fatigue. We also have underlying beliefs, and this is often the narrative that goes through a worker's mind when they're experiencing compassion fatigue. I'm the only one who can do this, and I have to do it alone. I have to be successful with everyone. Their needs always come before mine. I mean, I'm reading this and thinking to myself, this is exactly what I was thinking when it came to my situation early in my career. I know all about burnout and compassion fatigue. This is for those people who work in the healthcare industry and get a lot of training, and we think that we know all about it and that it won't ever happen to me. So we're sort of like, therapists do this all the time. They say, well, it'll never happen in my backyard, and yet we're some of the worst people as unique types of healthcare workers that don't do that. And a good therapist will go see their own therapist and work on their backyard and understand when they're getting triggered with compassion fatigue and burnout. And I learned a great lesson, luckily, early in my career. Another one is I can't feel satisfied unless those that I help are getting better. When you're that attached to outcomes, obviously the process becomes so much more important that everything else goes by the wayside. And so as I've gotten older and wiser, I have detached from outcome and made that more the responsibility of the clients. And when I say clients, I'm not just talking about therapy clients, I'm talking about the people that I go out and give these talks to. But what they do with this information is up to them. They're in control of outcome. And what that's done for me is it's made me care much, much more about the process of delivering the message and the connection that I make with the people on the other end. And so I'm much more tuned into that. And if you were to do that in your everyday life, in your workplace, at home, if you cared more about the connection that you make and the moments that you're experiencing within that connection and less about outcome, a lot of positive changes are going to come, and compassion fatigue is going to be reduced, and you're going to be managing it much, much more carefully. So honing into these underlying beliefs and these causes become paramount, and now it's your turn to do that. This is exercise number 6. I want you to identify some of the causes that you experience when you're having sort of that feeling of if I have to talk to one more customer, if I have to deal with, those kinds of things. And actually, that's the second part of this, is to list your negative beliefs or your rigid belief system about compassion fatigue. So, for example, if we go back to causes, are any of these things causing you compassion fatigue, or anything not on this list? Are any of these beliefs or other beliefs that you make up causing you to experience or sort of the thoughts that go with your compassion fatigue? So what causes you compassion fatigue, exhaustion, that feeling of I must go on, and what are some of your rigid or negative beliefs? I'll give you an example. One of my rigid negative beliefs is that when clients get better, they tend to leave my practice, and I get another sort of mental health challenge in my practice. That's a nice way of putting it. And what happens is people come into my office, and my negative rigid belief is I'm never going to make any headway with these clients, because every time somebody leaves my office, I get another one that comes back. Or I might even think I see a client make progress and then they fall backwards, like is very human and often the case. And I'll say, is this person ever going to get better? And that's a terrible thing for a therapist to think, because that will become a barrier to the treatment process. So I work very hard to combat those negative beliefs and become very patient with my client's process, and it makes me a more patient therapist. So think about that in your own work life. What are some of those negative beliefs that you experience, or the causes that pull you toward compassion fatigue? And then, of course, you know what I'm going to ask you to do. Put a Likert scale ranking on it of how severe that belief is, or how severe that cause is for you, so that you can begin to look at bringing it down that Likert scale. We're not going to be able to take it all away. We're not, I remember when I was a kid, my mom used to say, I'm going to make it go away. We don't live in that kind of a world. It doesn't just go away. It has to be managed, reduced, and managed. Okay, part 3. We're going to move into part 3. So part 3, as you're finishing up this compassion fatigue exercise, is the remaining piece to our talk today is I've already kind of talked to you about a philosophy of how can we approach. We approach through awareness. We move toward it. We get past our first level reaction of anger and irritation, and we get into second level consciousness. We take accountability in that second level consciousness. And so I've given you, while I've talked a lot about signs and symptoms and define compassion fatigue and burnout, and we talked about stress, I've given you a philosophy of let's move toward this. Let's be aware. Let's take accountability. Now, going forward, I'm going to give you specific strategies and tools that have worked for me personally and that I practice on a routine basis, that work for others that I've seen in my practice and others in the workplace and participants in these trainings. So some of this is experience-based, some of this is research-based, and hopefully all of it will become a part of your burn-up invention plan. So some general strategies and tools that you can apply both at the workplace and at home. For some of you who might be parents or might be working and struggling with a personal relationship that simply impacts your workplace environment as well, because we carry that stress to the workplace, you're going to want to do these 5 things. First, obtain clear expectations. Be as clear as you possible. And one of the favorite phrases that I like to use is, so if I understand correctly, this is what you're expecting. So clarifying these expectations is really important. Whether you're a supervisor or a supervisee, if you're a supervisor, you might be saying, so what can I expect from you in terms of getting this report done, and when can I expect it to be done? Okay, if you're a supervisee, talking with your supervisor, what would be your expectation around the time I need to show up for work and when you'd like me to have this report to you? This is just an example. Maybe a colleague, hey, my expectation is that we would try to collaborate on this patient issue and get this taken care of by next week. What was your expectation? So any type of clarification is really good around expectations. The second one is to know your boundaries. Sometimes we might have expectations, but we can't deliver, and so it's really important to provide boundaries as quickly as possible and in the most professional and direct way possible. So an example might be, Bob, this isn't possible right now because I have many other things on my plate and I'm feeling quite overwhelmed. And so what I'd really like to do is see if we could table this until a future time, and you let me know when it might be a good time for you. But if you could just give me a little bit of time, that'd be great. So boundaries come up in a lot of situations, both at work and in the home. It's really important to know your boundaries. Now, how do we get to know our boundaries? Well, we do it by practicing. And I'm going to give you a homework assignment. It's not a part of the written exercises, but practice boundaries. Practice them at home and at work just for the sake of creating boundaries. Don't make them ridiculous, and try not to make them get in the way of work productivity or other things, but practice even the small things. If you break it down into smaller chunks, you're going to get good at creating boundaries and keeping those boundaries. Creating a boundary is important, but when you go back on it, then you're undermining your own boundary, and people will not believe you and will not have faith in your ability to stand your ground. So I want you to practice those boundaries. Third, take a little bit of time for yourself. Many of us struggle with that. We're so inundated and so busy with so many things that we're constantly going toward other people rather than dialing in and taking a little bit of time for ourselves. And so I want to really encourage you to spend some time with yourself doing something you enjoy, even if it's for 10 or 20 minutes a day. But the key is to build that in daily. If you don't build daily time for yourself, you're going to have much higher likelihood of burning out and experience, or if you're in an industry where you're dealing with lots of people having compassion fatigue. Next, ask for support. Ask for support. Many people don't like to ask for help. They want to do it on their own. And if you remember that one underlying belief of I must do it on my own, that negates this point of asking for support. If I had asked for support the morning that my grandfather passed away and called up and said, hey, I need some support. My grandfather just died. I don't know what to do, whether I should come into work or not. Could you help advise me what the appropriate thing is to do? That would have been the right thing to do, and I didn't. And so, of course, there have been many other circumstances in which I've employed that strategy, and it's worked much better. Finally, remember that it's a marathon and not a sprint. When we sprint to the finish in the short term, by not giving ourselves breaks and constantly being on the go, we tend to burn out much quicker. And when we realize that this is a marathon, it's going to take time, and you're going to put in the energy with patience and fortitude, that goes much differently. So keeping these 5 general strategies and tools in mind, I want you to begin to think about building your burn-up invention plan based around some of these concepts and any others that you know of that you may have already studied. Here are some specific things that I want you to kind of think about along the way. So I really believe in mentorship, and of course I'm a Star Wars fan, and any of you who might have seen the Star Wars movies know that there is a lot of mentoring going on. Luke Skywalker is mentored by Obi-Wan Kenobi. Luke himself mentors R2-D2. And this is an example of not only mentoring others and getting your own mentor, but if you think about it, R2-D2 is a droid. He's not a human being, so he's what I call an out-of-field mentor. And Luke's relationship with Obi-Wan Kenobi is an in-field mentor. They're both Jedis. So you want to have some mentors that are in your field of study or work, and you want to have some people that are out-of-field mentors. This is really super important because if you only had in-field mentors, you lose the worldly perspective. If you only had out-of-field mentors, you lose the specific niche area of mentorship that you need. And I also think it's important to mentor others both outside the field and inside the field. So some of my out-of-field mentors, I coach a youth baseball team. I mentor children, not as a psychologist or a therapist, but just for fun, coaching baseball. I'm also mentored by outside people, like, for example, a financial expert who helps me with my finances, and other people like Malcolm Gladwell, whose books are partly psychological, but really about society and change and what makes people successful. You may know some of his books like Tipping Point and Outliers. And by the way, authors whom you've never met can be mentors, whether in field or out of field. So there's a lot of value to mentoring others and being mentored by others in this way. And so your next exercise, exercise number 7, is to identify several things. First, write down who in your life has mentored you. Write the name of that person or people who have mentored you. Again, they can be people you've never met or people you've worked very closely with. Next, write down 1 or 2 people, or more, it's up to you, of who do you want as a mentor that you've not gone to yet. So I have a list of books I haven't read yet. That would be people I want to mentor me. I have individuals that I've wanted to talk to and work under that I've wanted to mentor me, or that I've maybe sort of talked to already but not followed through with. Write those people down. Next, who do you mentor? Are you mentoring anybody right now? Are you doing a Big Brother program with somebody? Are you coaching a youth team? Are you doing something, mentoring a young professional that's just come into your organization? Write down who you mentor and if you're or who you would like to mentor. And then, of course, what I want you to do is next to these names, you can put an I for in-field or an O for outside of field and distinguish whether they're in your field or out of your field so you can get a nice view of this mentorship process. And then I want you to make a promise to yourself that you're going to follow up in each of these areas on a routine basis. I think you're going to get lots of joy from doing that, more support. This goes back to this sharing of asking for support. And I think that's really important, and giving support. It feels really, really good to give support. Okay, I call this next strategy, and again, we're getting really super specific on strategies. These are strategies, by the way, that I've developed. I've developed them in my own life. I've developed them as a critical part of working in my practice with people who suffer from anxiety, depression, burnout, any of these areas. And then I brought this message into these workplace trainings that I do, and it's been very, very well received. So this next specific strategy, and in fact, I talk about this particular strategy in my book that I wrote on improvement of helping people grow their practices. I'm a practice consultant and specialize in helping folks with that. And this is in the book. It's Finding Your Zen. Okay, and I came up with this acronym because it's so easy to remember, but this Zen place that you want to be in is what's going to help you really combat burnout and move into a burn-up phase. Z stands for sleep. E stands for a good exercise program. N stands for healthy nutrition, and S stands for spirituality. And we're going to take just a few minutes and talk about each of these. So let's talk about sleep first. I recommend, and most experts recommend, getting on average between 7 and 8 hours of sleep a night. They recommend trying to go to bed within about an hour of the same night. So if you typically go to bed around 9:30, the idea would be to go to bed between 9 and 10 o'clock each night. Obviously, I know that there are times in which you have a work function that goes late, or on the weekends you have a party to go to, and if those are once in a while occurrences, not such a big deal, obviously, but if you can always hit the reset button and go back to that 7 or 8 hours where you're going to bed around the same time, it'll really be effective. Try to not eat a few hours before bedtime. Sometimes eating stimulates the body and puts energy into our body, plus we have to expend energy to digest the food, and it really, really disrupts the easing in of sleep. Limit your stimulation an hour before bed, so I don't recommend exercising an hour before bed or doing stimulating kinds of activities such as looking at screens or interacting with video games, that type of thing. So you really want to try to move into a space where you're slowly moving toward your sleep process, and these are some specific strategies that can help you move into sleep. Now, if you happen to wake up in the middle of the night, one of these folks that wakes up, just lay down and do some breathing exercises to try to relax. And if you can't still fall asleep, get up and take a short walk perhaps around the house for a moment and then kind of come back to sleep. If you have thoughts that keep bothering you, keep a pad of paper next to you, write them down, and then leave them on the nightstand. Okay, as far as exercise goes, I'm a skier. I love to ski. I'm getting real excited about the ski season, even though it hasn't snowed yet. But what you want to do is 30 minutes of aerobic exercises or more, not too much, but 30 minutes or more about every other day. I like to do a run. Even if you just get up and walk, 30 minutes can be broken into 3 10-minute segments, as long as you have what I call movement moments. Okay, you want to move, and for many of us, we sit in a chair all day long. It's important to move. It's important to go outside on a daily basis. I try to do a run in the coolness of the morning every day. Allows me to spend some time outside. It's also important to have some strength training as well. Building strength is super valuable. Building muscle, keeping your muscle toned, in addition to aerobic exercise. And if you're concerned about how to do it properly, there are many trainers in most gyms. I would consult with an expert. It's extremely valuable to do that. Next, let's talk a little bit about nutrition, the N. Eat balanced. Balanced in time, quantity, and variety. A lot of experts suggest that it's better to eat smaller meals and increase the number of eating occasions while having less quantity. Of course, you know this already, which is avoid fast foods, fried foods, large portions, high sugar content, cut back on salt, artificial sweeteners, things like that. There's tons and tons of literature on how to eat healthy, and I'm not going to tell you this is the program for you. What needs to happen, these are just some basic recommendations, but I would find something that's going to work for you. I'm not a big fan of fad diets. They tend to go away right away. I'm much more of a fan of building your nutrition behaviors as in that marathon comment I made earlier. Hey, this is a marathon. We're looking at lifestyle changes and practices and behaviors that work with yourself and your loved ones, the people that are around you. So obviously cut back on alcohol and caffeine wherever possible. Drink plenty of water. That's very, very helpful. There's no calories in that, and our bodies need lots of water. And of course, if you have questions about what the right nutrition program for you, by all means, consult with a professional. Finally, in the Zen's category, we're talking about spirituality. Now, why do I have this as one of the 4 pillars of wellness? Spirituality is super important, and we often forget what spirituality really is. It's not religion. Now, religion is a form of practicing spirituality. So if you're a religious person and you find that it nurtures your soul and your spirit to attend a service or do a service or read the Bible or whatever, or the Quran or whatever you want, whatever your religious practice is or belief is, then that's a wonderful spiritual practice for you. There are many people who don't gain spirituality through those mechanisms, and so here are some other ideas. Connection to nature, going for a hike, being outside, listening to music, meditating or relaxing, spending time with family and friends, just being relational and sharing memories that are positive can be spiritual. Travel is a spiritual mechanism for many people. So I want you to think about that piece as an integral part of your pillar for wellness. And now, of course, we're going to bring all 4 of these together, and you're going to create in this eighth exercise, your Zen's plan. I want you to discover your Zen's by writing your plan for each of these 4 areas. Z equals sleep, E is exercise, N is nutrition, and S is spirituality. I want you to be specific and as realistic as possible in your goals and objectives that you're setting for yourself. So what you're going to do, perhaps in the sleep area, you're not getting 7 to 8 hours and you're only getting 5 to 6. If that's the case, don't say, I'm going to go to bed at 9 o'clock every night and I'll be done if I'm going to not get 8 hours of sleep every night starting tomorrow. Instead, I would say, I'm going to back my sleep up by a half an hour and try to get into bed a half an hour early and go from 5 hours this week to 5.5 for a week, and then I'll do another half an hour next week. So I really want you to think very intently on what is doable for you in each of these 4 areas. What I'd like you to do is go back, and if you don't finish this during our time together, because for time purposes, I want to leave time for a little bit of Q&A. I want to push through just the rest of our strategies, and so you'll want to come back to this. You don't have to Likert scale these, by the way. This would just be goal setting, identifying the issue, goal setting, and creating a mechanism for change for you that you can practice over time. And don't be hard on yourself if you don't attain the goal that you set. That's simply an indicator that you need to maybe simplify your goal a little bit and maybe tone your goal down or re-examine your expectation around your goal. Okay, the last specific strategy and tool I want to cover today is the mind-body experience. You remember when we talked about symptoms earlier in the talk today where we covered physiology. Our physiology houses everything. It houses your emotion, it houses your mental state, and so connecting the mind and body becomes very important. And I want you to think about engaging in the routine practice of purposeful relaxation. There are many ways that we can do this. One example would be a visualization technique where you sit and meditate and think about visualizing positive outcomes. You can also create mantras that you can say to yourself that are positive, like, I will get this work done, I will get this work done, I will get this work done. Or if you're feeling particularly insecure about your role in a particular project, you can say something like, my role is impactful, my role is meaningful, my role is impactful, my role is meaningful, and just sort of repeat it to yourself. I've even done things when I've prepared for a talk and been particularly anxious about public speaking. I've done things where I've said positive remarks to myself about my speaking ability, and then piped in music and then recorded it and then listened to it over and over and over again to help remind myself that I can do this and that I'm good at it, and that sending a message is really impactful and important. So I'll do some of those kind of techniques. You can do this revolving around anything. If you like structure, take a meditation course or a yoga class, or do some of this on your own. You can do yoga. There's lots of videos that teach you how to do yoga and meditation apps that you can download on your phone. There's so much in the world of meditation and yoga right now that's amazing. And then, of course, a simple breathing relaxation exercise. There's many different kinds of breathing exercises, such as box breathing and deep breathing. We're going to do one right now, is exercise 9, which is kind of fun, and this is one that I call the heart and belly compassion fatigue relaxation breathing. And this is one I actually developed through the process of recognizing that our torso tends to be where we are most bound by stress. So I have my patients do this, and I'd like for you to try this. Put one hand, either one, on your belly and the other hand on your heart, and take a deep, long breath in and feel the air go all the way into your chest. Just like that, and hold it for a moment, and then slowly, as slow as you can, push it out until you feel your stomach push your hand out and your stomach gets bigger. And then pause and take another deep breath all the way in. Hold it, and slowly, slowly let it out until you feel your stomach push at the end. Do it one more time. And out. Very good. What this does, it slows down our circadian rhythm. It oxygenates our brain and slows the neuronal impulses in our brain. And even you can tell that after I did that, even when I was instructing you in my breath, how I'm slowing down in my rate of speaking because I'm more relaxed, basically. Hopefully you experienced a little bit of, even if it was a very slight change. Now, of course, that just took about 25, 30 seconds. You can do it for 2 or 3 minutes and do 6 or 7 cycles of that. I think this exercise is a particularly effective exercise when you're in a heated meeting and you need to get up and just go away from the meeting for a moment, or just to take a time out for a minute. You can do this just about anywhere. So I wanted you to experience that as your 9th exercise. All right. So we've covered some really important general strategies, and then, of course, these specific strategies of mentorship, finding your Zens, and relaxation, mind-body connection type of exercises. Well, now I want to go back to the macro. I want to go back to the macro because I want to talk about this concept of burning up. I'd like to share a much briefer story, but a very impactful one. Many years ago, before I ever became a therapist, I was a summer camp counselor up in the Rocky Mountains in Colorado. And if you've ever been to an intense environment, even as a camper or a counselor at a summer camp, lots of emotions and intensity there. And you can almost imagine that sometimes the workplace is like a summer camp, intense with emotions and hot and coldness and whatnot. But we had a staff meeting every Saturday night at this camp. And I was probably about 18, maybe 19 years old at the time. And of course, I spent many summers as a staff up there. It was one of these jobs that had the most meaning and the greatest impact and the least amount of pay. So anyway, you've probably worked in those jobs before. So one day, near the end of the summer, prior to the very last session of kids coming up, our camp director walked into the meeting space with 2 large boxes that had no markings on it. And we were tired. We were burned out, tired. We are in full-fledged compassion fatigue. I mean, you could tell that our attitudes were negative. We could barely keep going on. And our director opened up these bags, these boxes, and he tossed out these playful plastic toys. One was an arrow through the head halo thing you put on. One was a clown nose. One was a googly-eyed pair of glasses. And he made everybody put this on, and he sat there, and we all sat there, and we burst out in laughter. And believe it or not, surprisingly had this energy of laughter. And here's what he said. He said, you know, I know you guys are burned out. I know you're having a hard time. Go take some time for yourself tonight before the kids come up tomorrow. Have fun, which is one of the interventions I gave. But he said, these kids are coming up tomorrow, and for them, it's the first day of camp. And they are expecting you to be the way you were on the very first day of camp at the beginning of the summer. And if you're anything less than that, you're not going to give them a good time. So you need to go recharge your batteries. And then he said, and let's spend the rest of the summer burning up and not burning out. It was a really awesome motivational speech. That's where this term burning up came from that experience. And I've adopted that because sometimes Thursday evening comes around, or Thursday morning comes around, it's my last day of clients. I don't see clients on Fridays, and I don't have any energy, and I have to remember that these clients, these patients who are coming in, deserve every bit of energy that the Howard Baumgarten had on Monday. And so I remember to recharge my batteries. And so that's where this concept comes from. And then later in my career, I realized that burning up doesn't come from setting a goal and waiting around for me to feel inspired. It's actually the opposite. it's a four-pronged process. It starts with activation. If we don't activate our energy, then we're not giving ourselves a chance to burn up. Now, mind you, activation doesn't come in the wake of exhaustion. This is after you've done your self-care. But you need to activate, and then once you activate, you begin to perspire. That's where the work happens. And once you perspire, you begin to feel that sense of inspiration. So if you're into sports, for example, teams score goals and touchdowns and home runs when they activate, create teamwork, perspire, and then they feel inspired. And the end of the game is when the goal is reached. The score at the end of the game is when the aspiration is either achieved or not. And it's okay if it's not achieved, at least you've gone through each of these four steps, because if the aspiration or goal ends up being different, you've learned something. So I encourage you not to place a value on hitting the target and hitting the bullseye. You're almost never going to hit that bullseye. What you are going to do is have an experience and an outcome that's meaningful and understandable. So remember to activate, perspire, inspire, and then see what the aspiration tells you. Finally, your last exercise is a homework assignment. What I want you to do is take this program that we developed, this template that you developed, and create a master plan. I want you to write 3 new and creative goals around each of these areas to help lower those Likert scale numbers and help achieve some of those goals that you're looking for. I want you to create smaller and attainable objectives, and I want you to make progress reports. So it's important that you set times to review your action plan, your burn-up invention plan. I want you to, whether it be once a week, once a month, down the road as you get better and better at this, you won't have to meet with yourself or others in your, you can do this with other people in as well and create a master plan of burning up with teams of people, but you won't have to meet as often as you get further along and get better at this. So start out by meeting pretty routinely and reviewing your objectives and how whether you're achieving them, whether you need to tweak them or change them, because you're destined to fail many times over before you succeed. So when we fail, let's not ditch the program. Let's get serious about changing our expectations, maybe lowering them, maybe being more realistic about our expectations. Now, if you're implementing this plan at home, you can do this at home as well to create more work-life balance and do a home plan as well. So these are relevant exercises that I really want you to commit yourself doing. If you go back and remember, you have your candle lit, you want to keep that candle burning. And in the spirit of keeping that candle burning, I want to leave you with some final thoughts. I want you to remember that fearless exercise of your passion and creativity, when you stay true and authentic to yourself, that's what ignites the flame and ultimately extinguishes burnout. And I do believe that we can get burnout to be extinguished by better managing it. So remember these final thoughts. I'm going to give you a couple of more strategies that are fun. I'll just run through this list real quick since we have just a couple of minutes left. Start a new hobby, talk with someone, ask for a performance evaluation, provide a performance evaluation, keep a feelings journal or daily affirmation journal or both. Think positive. It hurts a lot less to do so. Take a caffeine break for more than a week. Eat a fruit smoothie every morning, take a break from alcohol for more than a week, visit your doctor for a checkup, visit a mental health professional for a checkup, go for a brisk walk, do 10 or more push-ups, spend quality time with your family, plan a vacation or a fun time away and actually follow through, look at your money regularly instead of just worrying about it, see a financial planner, save a little bit every day, be creative, remember to sing to yourself and to others if you're good at it, and remember to laugh. And always remember to keep the flame burning. Thank you very much for your time. I'll take some questions now if you'd like to ask any questions.